Globally, the COVID-19 pandemic continues to intensify. Cases have now increased for the 9th straight week, and deaths have increased for the 6th straight week. To put it in perspective, there were almost as many cases globally last week as in the first 5 months of the pandemic. It's pleasing to see small declines in cases and deaths in several regions, but many countries are still experiencing intense transmission, and the situation in India is beyond heartbreaking. WHO is doing everything we can, providing critical equipment and supplies, including thousands of oxygen concentrators, prefabricated mobile field hospitals, and laboratory supplies. As I mentioned on Friday, WHO has redeployed more than 2,600 staff to support the response on the ground, providing support for surveillance, technical advice, and vaccination efforts. Never before has the value of vaccination been so apparent. Today marks the start of World Immunization Week, at a time when the world's attention is focused on vaccines like never before. With the theme, Vaccines Bring Us Closer, World Immunization Week shows how vaccination connects us to the people, goals, and moments that matter most, helping improve the health of everyone, everywhere, throughout life. Vaccines are one of the most powerful and transformative inventions in history. Thanks to vaccines, smallpox is now in the history books. Polio has been pushed to the brink of eradication, and once feared diseases like diphtheria, tetanus, and meningitis are now easily prevented. And new vaccines continue to push back the frontiers of disease. In the past 15 years, new vaccines have been approved to prevent cervical cancer, malaria, and Ebola. And now, safe and effective COVID-19 vaccines have been developed in record time, bringing us closer to ending the pandemic. On Wednesday, the WHO Foundation is launching a new global fundraising campaign called Go Give One, to give everyone a chance to play their part in helping to vaccinate the world. Go Give One is aiming to engage 50 million people to contribute, and is open to everyone, individuals and organizations of all sizes. The money raised will go to COVAX to buy vaccines for the world, starting with those who need them the most. More information will follow this week. But even as COVID-19 vaccines give us hope of light at the end of the tunnel, the pandemic has caused several disruptions to immunization services around the world. New WHO data shows that as a result of COVID-19, 60 immunization campaigns are currently suspended in 50 countries. That means about 228 million children are vulnerable right now to deadly vaccine-preventable diseases such as measles, yellow fever, and polio. Measles campaigns are the most affected, accounting for 23 of the postponed campaigns. Many measles campaigns have now been delayed for more than a year. In addition to targeted campaigns to prevent or respond to outbreaks, routine childhood immunization services also continue to be disrupted by COVID-19. The latest WHO Pulse survey shows that routine immunization services were disrupted in more than a third of countries in the first quarter of 2021. While this represents a significant improvement over last year, it remains a serious concern. Gaps in vaccination coverage are already having grave real-world consequences. Serious measles outbreaks have occurred in several countries, including the Democratic Republic of the Congo, Pakistan, and Yemen. And the risk of measles outbreaks is mounting elsewhere, as more and more children miss out on the vaccines they so urgently need. So we must turn the tide quickly and rebound from these disruptions. WHO, UNICEF, GAVI, and other partners are working with countries to ensure that immunization services are restored quickly and safely. But we must not forget that even before the COVID-19 pandemic, nearly 20 million children missed out on life-saving vaccines each year. So we must not only get immunization back on track, but do better than before. Today, we're launching a bold new plan to do just that. The Immunization Agenda 2030 is an ambitious new global strategy to maximize the life-saving impact of vaccines over the next decade. Our aim is to maintain hard-won gains in immunization, avoid backsliding, and achieve even more by leaving no one behind in any situation or at any stage of life. If fully implemented, the Immunization Agenda 2030 could avert over 50 million deaths over the next decade, 75% of them in low and middle-income countries. To achieve these goals, all of us must step up and take action. First, we call on world leaders and the global health and development community to make bold new commitments to advance this strategy. Second, we call on all countries to develop and implement national plans that align with the Immunization Agenda 2030 and increase investments to make immunization accessible to all. Third, we call on donors and governments to increase investments in vaccine research, development, and delivery focused on the needs of underserved populations. And fourth, we call on the vaccine industry and scientists to continue to accelerate research and development, ensure a continuous supply of affordable vaccines to meet global needs, and apply lessons from COVID-19 to other diseases. Together, we can make up lost ground in immunization, support the global recovery from COVID-19, and make sure no one misses out on the life-saving power of vaccines.
Hello everyone. HW News English is 2 years old now. When we started this venture, we promised ourselves one thing, that news should remain free, because right to know is the right of every Indian. But to keep news free for everyone, we need support from some of you. And thus we have rolled out membership on our YouTube channel HW News English. But mind you, the membership is completely voluntary. The programs that we were doing earlier, that we are doing now, will continue to remain free. First level is a basic level. Here, you can be our supporter by paying Rs 199 per month. This membership gives you certain perks and benefits. The perks include unique badges in front of your name, a live show from Mr. Sujit Nair and from Mr. Akhilesh Bhargava per month for our members. You can also vote in some exclusive members-only polls. Now the second level is Super Supporter. Here you can be our Super Supporter by paying Rs 3,999 per month. This membership will include every perk that comes with basic level. Additionally, our Super Supporters can be a part of a WhatsApp group where we can have discussions and suggestions on various topics. The second perk includes a gift pack with our merchandise. And the third perk is a Google Meet with Mr. Sujit Nair, where you can join the meet and ask your questions to Mr. Nair face to face. Lastly, if you like, we would give a shout out to our super supporters in our programs. So, hope to see you soon with our badges.
Now be the first to know about the latest updates on our new news app. Go on your Android or iOS, search for HW News Network. Download our app, choose the language you prefer to get updates in, and be up to date with the latest news.
If you like this video, please share it, and we would love to hear your comments in the comments section down here. Also, please do like our Facebook page and follow us on Twitter to get minute-to-minute news updates. For more such shows and videos, well, subscribe to our YouTube channel.